It's now 6:30. I'm going to hand over to Dr. Mohali. Dr. Mohali, over to you. Dr. Mohali, over to you.
Thank you, Ranir. Good evening, colleagues, and welcome to the first webinar in the South African Medical Association's MMED Mastery webinar series for 2025. I am Dr. MMED Mohali, and I have got the pleasure of facilitating our session this evening. So just to provide you with a little bit of background as to how this series came about. It is worth noting that in 2023, the South African Registrars Association conducted a survey amongst registrars from various universities nationally in order to identify and assess any gaps in as far as MMED research support is concerned. The findings revealed that there were diverse needs and gaps with some registrars lacking insights on research topics, how to approach and obtain ethics approval all the way through to publication support. Following which, in 2024, the South African Registrars Association, SARA, hosted a monthly MMED Mastery webinar series with topics ranging from choosing your research topic all the way through to publishing your research. This webinar series subsequently culminated in the first ever South African Medical Association in-person writing retreat hosted at the South African Medical Association's head office in Gauteng. Now, backed by popular demand, we're embarking upon hosting a similar webinar series, which will also culminate in a writing retreat that with the aim of assisting registrars in completing their MMEDs or their Masters of Medicine within the allocated 4 years of study. And this webinar series will or seeks to provide tailored support to address varying research preparedness or gaps and readiness levels amongst registrars. However, it is worth noting that and as much as the program seeks to capacitate and assist registrars with completing their MMED research on time, the invite is to be extended to other colleagues who have got a keen interest in research but may not yet be in registrar programs, such as our medical officers. And without much further delay, colleagues, I now have got the pleasure of introducing you to our first speaker, who will be providing us with insights on choosing a research topic. And this will be Professor Naidu. Professor Naidu is an accomplished family physician and health leader who's currently serving as the head of clinical unit and associate professor in family medicine at the KwaZulu-Natal Department of Health at the University of KwaZulu-Natal. Professor Naidu holds multiple advanced degrees, including an MB-CHB, 3 master's degrees, and a PhD, and is also a fellow of the College of Family Physicians of South Africa. Professor Naidu boasts extensive experience in clinical practice, academic teaching, leadership, and postgraduate training. He currently serves as president of the College of Family Physicians, vice president of the Colleges of Medicine, and is the incoming president of the South African Medical Association. His roles include strategic leadership, stakeholder engagement, and promotion of professional development. Prof has led various SARA committees and conferences, demonstrating a long-standing commitment to family medicine and healthcare equity in South Africa. Prof, over to you.
Thank you so much, Monique. And thank you for the invite of allowing me to do this presentation for the registrars. It's an area that I'm actually quite passionate about, and I'd previously chaired the Education, Science and Technology Committee of SAMA, and we had actually started this process through the EST, and it was during the COVID years, and we actually had some of the similar sessions, but we had everything online, and even our writing retreat was done online. I think we did a writing retreat to show people how to develop literature review. Anyway, today I'm going to be talking about choosing a research topic for your MMED. The outcomes of this talk would be to understand the importance of a well-chosen research topic. So a really important to choose a topic that you're not going to want to change later on. Identify criteria for selecting a feasible and relevant topic. Generate ideas from your clinical settings and align your topic with national health priorities and your personal interests, and try to avoid some pitfalls when it comes to topic selection. So the types of research that you may want to consider, depending on where you are, you could be in a lab medicine-based discipline. So you may want to do something in the biomedical field, where you do biomedical research used. If you're doing chempath, that may involve doing laboratory investigations, etc. You may want to do some clinical research, and obviously there's various different methods of clinical research. In fact, all of these offer various different methods in which you can do the research, from quantitative to qualitative. I would not really recommend mixed methods research for a registrar. Then there's health services research, and health systems research, if you are really involved in public health or interested in public health. So public health tends to traverse all the disciplines. So all of us have interest in research. And then there's educational research. And if you want to just see, okay, what's the impact of work-based assessment on registrars' perceptions of their competencies, etc., because that's a big topic for discussion at the moment in the colleges of medicine. So why choosing the right topic matters? So it does set the direction for your entire project. It can affect feasibility, timelines, and funding. So that's really important, because you don't want to choose a topic that is too aspirational and find out that you can't get it off the ground. It impacts your motivation and completion. And it also determines contribution to practice, policy, or education. So your research can have some social value. So what would be the key criteria for a good MMED research topic? So it must be relevant to clinical practice or public health. It must be feasible within time, resources, and skills available. It must be ethically appropriate and acceptable. It must have some areas of novelty or useful. It fills a gap or solves a problem. It must have a clear focus and a researchable question, and it must align with your MMED discipline or your MMED outcomes. So really important, because you are doing an MMED in a particular discipline. So when we talk about social value of research, you want to address real-world health problems affecting communities. You want to improve patient care, service delivery, and health outcomes. Your little project may inform policy and health system strengthening. You want to look at reducing health inequities and support vulnerable population. You want to build trust and engagement with communities, and demonstrate accountability to funders, institutions, and society. So when you're doing your proposal, you need to actually take these considerations into account when you're planning your research, because these are the types of things that the ethics committee would be looking at. The scientific value of the research, you need to look at advancing knowledge in your discipline of medicine or public health. So you may choose a topic that has already been researched before, and you know the answer for it, say, in a Western environment, but you don't know the answer in your context. So you are bringing new knowledge to the field by researching that topic in your context, which is very different from a first world context, for example. You want to fill evidence gaps and generate new insights. So often registrars research, I'll share some examples just now about how we actually were able to do that for a project that I was involved with. You want to build on existing literature using rigorous methods, because your literature, if you've done your research well and you've published it in a peer-reviewed journal, your literature will be quoted. And I've got some students who've had up to 50 to 60 citations from their research. You want to enable replication, comparison, and validation of findings. You want to contribute to your postgraduate scholarly development. I think research also teaches you to actually scrutinize research and how to do critical appraisal of research. So when you see new evidence being being published in your discipline, you can scrutinize the evidence and look at the methods and look at the rigor of the trial, the study itself, and then decide on your own if it's worth actually applying to your setting. And it can also inform future research guidelines and training curricula. So when you look for research ideas, a lot of time people will think, no, I need to go and ask somebody experienced, or I need to go and read the books, etc. But actually, it doesn't come from that. It comes from your clinical experience. And every day you are seeing patterns, you're seeing problems, you're seeing gaps. So I'll give you an example. So I was doing a ward round with an intern, and we had to admit a patient who was on warfarin for atrial fibrillation. And I told the intern, it would be nice to do a study to compare the cost-benefit analysis of warfarin versus the new DOACs, the direct oral anticoagulants. And so he asked me, why don't I do that study? Because, warfarin is associated with a whole lot of problems, as people know, monitoring, side effects, inconvenience for the patient, etc. So I said, why don't you do it? And then as an intern, he registered for an MMED Sci, and we actually looked at it. And we published 2 articles from that MMED Sci. And one was on looking at the cost-benefit analysis of warfarin versus DOACs. At that time, the DOACs were very expensive. There were no generics out. But now there are generics, so it's worthwhile to maybe look at it and see whether it does have any benefit. And we found that warfarin was still cheaper. And then we also developed a guideline on the management of atrial fibrillation in the South African setting. And that's been extensively cited, and I use it as a guideline for my interns and medical officers and registrars in my setting now. So there could be patient care issues in terms of delays to care, outcomes, safety concerns that you may have, that you see in your practice, and that could actually become a researchable question. You could look at guideline implementation. For example, if you know that the current South African guidelines recommend the management of pneumonia to occur in a specific way. We just published an article in BMC Infectious Disease last year. There was also a registrar that I had supervised, and it was about looking at doctors at a regional hospital and their practices towards using pneumonia guidelines. So it turned into a research project that we published. You could look at hospital audits and what needs improving in the hospital. So you may want to look at, we had a registrar who looked at diabetes, for example, and looked at all the patients we were managing in the outpatient department who had diabetes. So we went through a systematic random sampling of about 400 diabetic patients. She collected a lot of data at the end. She could have published like maybe 3 articles out of the research that she collected, but she just wanted to get over the line, so she published 1 article, which showed that our control of diabetes is not actually very good in the public sector, and certainly also in the private sector from some of the data emanating from Discovery, etc. And so those, I mean, diabetes needs improvement. There could be supervisor suggestion. Your supervisor may already be involved in the study and may want you to link with his area of interest if you have a little passion for it. And then there could be your national priorities, your burden of disease, PhD engineering, for example. So as I said, I had a registrar who did a topic on diabetes. And from that, we decided to develop an intervention in the hospital. So now I've got an intern actually who was doing a study looking at the group empowerment and training, which is a low-cost intervention to implement a group empowerment and training using structured 4-session over a 4-month period, and see if that has an impact on the diabetic control and empowerment of patients in their diabetic management. Diabetes is a really big problem in South Africa, and the second leading cause of death. So it's a really important topic to actually research. So the clinical questions that spark research. Okay. For example, why do you see poor diabetic control despite regular visits? So that could be the type of questions that you could ask. What are the other reasons for the high default rates for TB treatment, for example? If that is your reality, how effective is our admissions protocol in reducing mortality? I mean, I developed an intervention at the hospital, and we've just published an article on that, on how what we found when we looked at mortality in our hospital, and what that allowed us to do and intervene in terms of developing a dedicated admissions ward and a high care unit. And that has had an effect on reducing mortality. So you could ask, what are the surgical outcomes of emergency laparotomies in our unit if you're a surgeon, if you're a surgical trainee? I'm currently co-supervising an ONG registrar, and her research question: how does syphilis in pregnancy affect maternal and fetal outcomes? So you can see that there's a wide range of topics that you could develop from your clinical practice. Other topic examples would be barriers to continuity of care in ambulatory care, because that is a real problem, because you have multiple stakeholders, especially in the public health system, and sometimes they don't talk to each other. And I've had examples of patient safety incidents because the patient was getting a diuretic from a GP, a PHC clinic, and a district hospital, for example. Antibiotic practices for whatever, for pneumonia, for UTI, for pyelonephritis, for prophylaxis of surgical procedures, for example. The role of specialist service on patient outcomes, if you're more interested in public health type of research. You could look at mental health screening uptake in the antenatal clinics, because that's a new intervention that has been introduced in the maternity case record. And you can see if that, and you know, that's a really important area, because there's an increased incidence of suicide among pregnant women, and it's significantly contributing to maternal mortality. So mental health screening is really important in that vulnerable population. And then you could even use your research topic by evaluating a quality improvement intervention that somebody else is involved in, and your topic will be just being on evaluating this intervention in the hospital, because you know most hospitals have to come up with quality improvement projects to improve their health outcomes. So as I said, you can align with your national Department of Health priorities, and these are your maternal, neonatal, and child health priorities. HIV, AIDS, and tuberculosis, non-communicable disease, violence and injuries, mental health, and emerging and re-emerging diseases. Things like the strategic plan for HIV, TB, and STIs, the burden of disease reports. Currently, a lot of people are talking about PHC re-engineering and universal health access, and then you could even look at district health plans. So when you have chosen a topic, trying to get rid of this bar that keeps on blocking stuff. So when you look for tools for refining, so in interventional study, we normally use PICO, which is population, intervention, comparison, and outcome. And in observational studies, we use PECO, so your population, exposure, comparison, and outcome. So you could use this tool to actually refine your topic after you've decided on an area. So if you've decided, okay, I'm not sure what I need to do, and I'm not sure, I've got these couple of ideas. So this is how you can go about choosing a topic. So you identify a broad area of interest. You narrow it down based on feasibility. You can discuss it with your supervisor and clinical mentor. You can do so you may have 3 or 4 ideas in your mind. So this is what you need to do. You can do a preliminary literature search. You can check local data availability, and then you can frame a clear research question. So those are the steps that you would take in defining your topic. And then what I normally do is I say, right, write down all these topics you have in mind, And out of 10, score each of the following areas. First of all, how feasible is this in doing it in your setting? Because sometimes you may have some great ideas, but leave that for PhD. For MMED, it's a 25% research masters. So do something that you can complete among all the other responsibilities you have as a registrar. It must have scientific and social value. It must be novel, and it must be something that you are passionate about. So score yourself out of 10 for each of those areas. And if you've got like multiple topics to think about, or you're thinking about, and you've developed these multiple research questions, then you score yourself 10 out of 10 for each of those areas. And the topic that has the highest value, closest to 50, is the topic that you choose, because that obviously would be something that you would rate highly. So the common mistakes that people make is being too ambitious or too broad, choosing a topic with no available data, ignoring your ethical. So, I mean, sometimes you may want to choose a rare condition and you only see 2 of those conditions in a year. So you may not have enough data to actually write it up as an MMED. So just be careful about that. Ignoring ethical considerations. So some of you may say, no, I really want to research something, but it's actually among a teenage population. And, you know, when it comes to research in children, there's usually lots of problems. It is doable, but it is a long journey, and you'll have lots of questions from the ethics committee. Failing to consult your supervisors early. So make sure that you bring them in and rope them in from at an early stage and bounce ideas of them. Send them your work as you develop it and get feedback, and then obviously improve it as you go along. And then choosing a topic with low relevance to your training. So sometimes you choose something that you're not able to do in your current clinical environment, and it means traveling out and going elsewhere to collect the data. Then it creates a little bit of problems, and then later on you find you aren't able to complete the task. So the final tips for success: you need to start early and explore your clinical environment. Topics are flying around you all the time. You just have to, what I normally do is, as I do a ward round and I ask a question, we have, even in our handover rounds in the morning, I normally would ask somebody to actually go and check up on certain things. And we're using AI now, so because sometimes I forget who I asked to check. So nowadays I tell, okay, take out AI, look at Meta, all of you put it into Meta and ask. So you know, something that you can explore in your clinical environment, and these questions that you ask in the ward round can become nice research questions. Document your ideas and then discuss this often, you know, and then brainstorm around it. Brainstorm with your supervisor, brainstorm with your other registrar peers. You can brainstorm with a senior registrar, etc. And then link to workplace improvement where possible. So be pragmatic. Small studies can still be very impactful, and keep alignment with your MMED training. So resources for further help, obviously, there are various, most universities offer research resources. So remember, please access this, makes your life much, much easier. For example, referencing tools. Most universities, if you are registered for the MMED and paying a fee, you can get like free access to referencing tools like EndNote. There could be online MMED project archive. So if you're not sure, go and have a look at these MMED projects, and the topics are chosen, and that may give you some ideas as well. Supervisors and research mentors. So especially if you have supervisors who said, okay, we had a project and this is what it yielded, and the registrar at the end of it said, these are ideas for future research. So those are some things that you can pick up and run with. And then library databases like PubMed, Google Scholar, etc. Those are all useful resources to have. So this is an example, this was an article of choosing a topic and developing a proposal. So you ask your research, what do health promotion officers think and feel about the implementation of group diabetes education program? So Prof. Mash is the one who runs this Grade for Diabetes program from Stellenbosch. And then the aim was to explore what health promotion officers think and feel about the implementation of a group diabetes education program. So if you are introducing something in your clinical environment. It could be a form of educational research, and you can research what the recipients of that research or the trainers of that research feel about that. And then you obviously define your objectives, and based on the objectives, you can then decide what type of study design. And the first one was a qualitative focus group interviews. Second example, what is the prevalence of substance abuse and its risk factors among adolescents attending high schools in an example area? And then the aim aligned to that research question, determine the prevalence of substance abuse and its risk factors amongst adolescents attending high schools in the example area. And this was just a survey, a cross-sectional survey. And you may have, so now we have great access to things like RedCap at most universities. So you could use an online research repository to collect your data, and it's free. How to improve, the third example, how to improve quality care for congestive cardiac failure at example community health center. And the aim was to assess and improve the quality of care of congestive cardiac failure at example community health center. And this was a quality improvement cycle design. So this is how you can develop your study design, by just having a topic and then framing it appropriately. So I don't know if we have time, but you can maybe say, choose a clinical problem in your current rotation. What bothers you? What could be improved? And how can you study it? So, I mean, I'm happy for you to put up your hands. Rainier, can we help this process?
We can do that, Prof.
So if you put
Thank
your
you
hand up, and
for a
if you want to
most
share, please do so.
presentation. We do have a question in the Q&A box. However, it pertains to appraisal of articles, which would like to be covered in one of our subsequent webinars on literature review. It's not for the scope of today's webinar.
Okay. All right. So, but if you haven't, you can put it in the Q&A, and then we can probably address it there afterwards. So if you have something that you want to talk about that's in your clinical practice, and we can talk about it in the Q&A. Right. So just to reiterate, just to emphasize it again, feasible, must have scientific merit, social value, novel, and most importantly, it must be something that you're passionate about. So good luck with your MMED studies and your research. Don't make it too complicated. Make sure you read and you write. So don't, most people tend to leave this and say, I'll get around to it. Give yourself some time and say, I'm going to read about it. I'm going to spend even half an hour a week on this, and set yourself some tangible targets. So year one, you want to complete your proposal. Year two, you want to get it ethically approved and collect your data. Year three, you want to start writing it. And you know what I often do is I actually work it such that the registrars are given dedicated leave to go and do this, but they have to first do the work, and then I will give them leave to, for example, we normally give them up to 5 days to write the proposal. We give them 10 days for year two, year three, and year four to actually do these activities. And it's planned in advance, and it's so that they have time to do that. So you use those opportunities. It's in the DPSA circular about exam leave. So please use those opportunities. I'm happy to take any questions, or if there's time.
Okay. Thank you again for an insightful presentation, Prof. We do not have any additional questions in the Q&A box, but I was just wondering, in addition to applying the finer criteria in, writing up or establishing a research question, what sort of additional nuances or criteria can we use to sort of ascertain whether or not our research topic is indeed relevant, particularly if we have chosen a topic in which there is a wealth of research that has already been conducted? So how do I know that my research question is indeed relevant?
Yeah, that's a really, really important question. So we'll be covering that in the next topic when we're doing the literature review. So basically what you do in your literature review, once you do your literature review and you've got your your database of articles aligned to your research topic, then you actually do an evidence synthesis table. And the evidence synthesis table will identify what these articles say, but more important, what are the gaps and how it relates to your research question. So if you then actually develop this evidence synthesis table that we'll talk about at the next webinar, you actually will then show relevance in terms of your topic. So we'll do that in a bit more greater detail when we cover the literature review next month. I think there was a question in Q&A. Any tips for appraisal of articles? Oh, lots of tips for appraisal of articles. I think that there are quite a few websites. I could share that with you that you could use that have got useful. Most of the journals have got some resources, the big international journals, about how to actually critically appraise articles. And the best way to learn how to critically appraise is to actually dive in and start doing it. So the easiest thing to do is to start in your journal clubs in your discipline and volunteer to do it for your discipline. I mean, I routinely give journal articles to our registrars to present in the journal clubs, usually on the first Friday of every month, and give them all the resources. We publish a series of articles called Mastering Your Fellowship in the South African Family Practice Journal. And we have in there questions based on journal articles. So if you want, you can actually go and look at those. And these are questions that we actually use in the exams. These are some of these questions are previous exam questions that we use in our CRJ art paper 3. So you can go and look at those questions and try to answer them. And then we then provide you with the model answer as well. So you can go and have a look at what's written. So these are usually written by people who are very well established in research around the country. So it's a resource that you could actually search called Mastering Your Fellowship. And it's available on the website of the South African Family Practice Journal. But I think if you start with the journal clubs, and then when you get your confidence up, you can then actually register as a junior reviewer for one of the journals. So I think SAMA has got a whole host of journals. You can actually then contact the editor and say, you're not an experienced, you would like to actually you want to peer review, critically appraise the journal by being a peer reviewer. But you would like to have some guidance during your formative phase, and they're usually very happy to support. I mean, I know some of my registrars approached me, and I would critically review with them, and they would declare that. You need to declare that you're a junior reviewer, and you use Prof. Naidi to assist you with the review. And then a lot of them are now, I use them as reviewers for some of the journals that I'm an editor on. Thank you.
Thank you again, Prof. Naidu. Colleagues, Prof. Naidu does have to leave, so if you have any additional questions, please post them in our Q&A box at the bottom of the screen and he will respond to you via email. Prof, congratulations and all the best for your term as SAMA President. We're looking forward to working alongside you. Thank you for joining us. Goodbye.
Thank you. Thank you, Monique. Bye.
Bye. Colleagues, our next speaker is none other than Dr. Sepile Tlali. And Dr. Tlali will be providing us with a few insights on the approaches that one might take when embarking upon a research project. And Dr. Tlali is a final year registrar in anatomical pathology at Wits University. He completed his undergraduate medical training at the University of Cape Town and subsequently completed his internship and community service in the East London Health Complex. He previously served as chairperson of the Junior Doctors Association
Dr. Moali, are you still online? Dr. Tlali, can you hear me? We just lost Dr. Moali. Dr. Tlali, maybe you can just take over. And maybe you can just start your presentation. I don't know how long Dr. Moali is going to be until she's back.
Yeah. Thank you so much, Renee. Could you please allow me to enable my video? Thank you. Please confirm if you can see my slides.
We can see the slides, but it's in presentation mode.
Can we close that then? Try that again.
Okay. I think it's going to work this time.
Okay. Can you see them now?
100%. Thank you, Dr. Tlali.
Please confirm if it's progressing.
It is. Thank you.
Fantastic.
You can continue.
Thank you so much. Unfortunately, my intro and my bio is not as accomplished as Prof. Naidu's, but before Monique or Dr. Mohali got cut off, I think the only part that was left to be said was that I'm also doing well during my doing my MMED project, and currently I'm in the write-up phase. So what I'm going to be talking about here is something that I've experienced, and it was quite a journey for me, and it's different for everyone. And hopefully this can help everybody who is either early in their research or about to start their research. Okay, so when starting registrar training, it's a time of mixed emotions, right? You know, you get that email and immediately you have this feeling, that mama, I made it feeling. And this is a picture from the music video from that song. That is then followed by excitement. You know, you feel like you're about to realize your dreams. Life is about to get better. Everything is falling into place. Before you know it, anxiety kicks in. Oh my gosh, I'm going to be a registrar. I'm not ready. Maybe I'm not good enough. And before you know it, you get swept off your feet. Everything starts. And on top of that, you start developing imposter syndrome. All right. So now you've started as a registrar. What now? First thing we need to do is to make sure that you're registered with your university, make sure that you complete any departmental or postgraduate office registrations, and to also remember that registration with the university is a requirement that needs to be done every year. This also includes filling in the HPCSA Form 9, which is also an annual requirement and something that we often struggle with. Next thing you need to do is understand your institutional requirements, read your university's MMED research guidelines, clarify deadlines for protocol submission, ethics approval, and final submission. Identify the minimum and maximum research scope expected. Then, as Prof. Naidu has spoken, you need to choose a feasible topic, and I think he's covered it quite well. I'm not going to expand on that. What I'm going to expand on is finding a supervisor, and I'll add a bit more a bit later. But for now, you need to identify a supervisor with expertise in your area. You need to consider somebody who's supportive and accessible. Discuss your idea with them early on. That can help refine the topic. And just to know that, you know, with regards to choosing your supervisor and your topic, you can either choose your topic first, and based on the expertise required for your topic, then find a supervisor who's an expert in that field, or choose a supervisor that you like, admire, somebody who you potentially have a good relationship with, and then maybe they can provide you with a topic that you can work with. All right. Then you need to, well, you don't have to, but some universities would like you to attend research methodology and ethics courses. And most universities require you to complete compulsory courses in research methodology, basic statistics, research ethics. These courses provide a foundational knowledge for developing a sound protocol. Thereafter, you will need to do a preliminary literature review, which will be discussed in later webinars. Search recent papers to see what's been done, where the gaps exist. Note common methodologies used in these past researches, and these will help you guide your study design. Thereafter, you have to develop a research question. Make sure that your question is clear, specific, and answerable. And you can use frameworks like PICO, as Prof. Naidu touched on in his presentation. Then choosing a study design. Decide if your study is going to be retrospective, prospective, an audit, or systemic review. Check what data you can realistically collect within your time frame. You do not want to do a PhD level research for your MMED. And I think Prof. Naidu also discussed that nicely in his presentation. So once you've done your literature review, once you've done your courses, the next thing to do is to draft your protocol. And within your protocol, you need to include the background and rationale behind your study, the research questions, aims, and objectives, the methodology, study population inclusion and exclusion criteria, data collection plan and variables, proposed analysis, ethical consideration, and timeline. Also seek feedback from your supervisor, and if possible, ask senior registrars or other researchers for practical advice. Just to a note on the protocol, you need to make sure that your protocol is solid, because once it has been approved, you can't really make any changes in your research forward without having to reapply. All right. What then follows afterwards, once you've drafted your protocol, so depending on the department that you're working in, some departments require you to present your research to the department, where they will either critique, advise, or give any form of feedback about your research, and either approve or disapprove your research as being MMED worthy. Thereafter, you need to apply for ethics approval. Most commonly for MMEDs, we apply to human research ethics committees in the respective universities. However, depending on your research, maybe it might not necessarily be the HREC that gives the approval for your research. About ethics approval, this is a mandatory step for any research involving human subjects or their data. You must obtain approval from the university's faculty, health science research ethics committee before commencing any data collection. Studies involving audit of clinical records also require research ethics committee approval. Prepare all your required documents, protocol, consent forms, if needed, questionnaires. Allow enough time for the ethics to be approved, as it may take weeks, months, or even a year, which was the case in my experience. And then you also need permission or approval from the hospital. Often it is from the hospital CEO if you're going to be conducting research in that specific hospital. And then sometimes some researchers may require you to register on the National Research Database. And lastly, once your ethics approval has been approved, the last thing you need to do is submit it to the Doctoral Degrees Board in order for them to allow it to process as a project. Thereafter, you need to plan your data collection. For that, you will need to set up secure systems for collecting and storing data. And most importantly, you also need to pilot your data sheet if possible, because this can assess for any gaps or problems in your data collection that you may have missed, you or your supervisor may have missed. And then lastly, you need to organize your timeline, break tasks into realistic chunks. So for example, say I want to do my literature review by this date, and I want to do my data collection by this date. Make sure that it's realistic and account for any calls, rotations, and exams that you might have in your registrar training. Make sure that you keep good records. Save all the versions of your documents. You know, I can't count the number of times I may have deleted something in a later version of my protocol literature review, of my data analysis, and then later on want to actually bring it back. So make sure that you keep them all. Make sure that you back them up securely. There are many platforms you can use for that: Google Drive, OneDrive, and the universities often give you access to Microsoft. So if you have access to that, just make use of it, as they do give you quite a lot of space. Lastly, and I cannot emphasize this enough, speak to your colleagues who are either recently finished or very advanced in their research, and ask them for practical advice, because their advice is gold. They will tell you and teach you about tricks and that you can use to survive your MMED. And then lastly, I just want to quickly talk about tips on finding a suitable supervisor, which is something that I presented on last year. So firstly, you need to identify your research interests, reflect on the subjects and areas that fascinate you the most. I think Prof. Nanji also touched on that. This will guide you towards finding a supervisor who shares similar interests. Research potential supervisors. Look into the research activities and publications of potential supervisors to ensure the expertise aligns with your interests. And then look into the faculty and departmental policies, as these can differ from one university to the next. Some universities might have guidelines on who can supervise who and on what. Make sure that you start early, and by start early, I mean looking for a supervisor, not necessarily your research, but even that you don't want to delay for too long. Begin your search at least within the first 2 months of registration, and assessing out, seeing what people are interested in, so that you can get the ball rolling. And also do not feel shy. Please, as a new registrar, consultants generally know that, you're going to be looking for a topic. So you're not going to be inconveniencing them by having a discussion about it. Effective communication is important. Reach out to potential supervisors with a clear and concise email outlining your research interest and why you think they would be a good fit. And then, importantly, you need to schedule a meeting. If possible, arrange a meeting to discuss your research ideas and get a sense of a working relationship. Be open to co-supervision. Depending on your research, having one or more co-supervisors, especially for interdisciplinary work, might be beneficial. And lastly, resilience is key. So oftentimes you might find that there's a supervisor that you like, but unfortunately, maybe they are inundated with many research projects, or maybe it's just not something that interests them. Don't be discouraged if they can't take your project on. Keep trying. And also don't be shy to ask multiple consultants and see who you like the most. Lastly, remember, a good supervisor does not only have the expertise in your area of interest, but will also be someone with whom you can build a strong relationship going forward. So keep that in mind. All right, and that's the end of my presentation. Thank you.
Thank you, Dr. Tlali, for that informative presentation. We really do appreciate you sharing your insights with us. And we do have one question for you so far, and that asks whether or not you would mind sharing any challenges that you faced, if any, when you began your MMED research, and what strategies did you employ to overcome them?
Thank you. That's a very good question. So yeah, I mean, I didn't listen. I'm a very I like solving problems. And initially, when I started my training in anatomical pathology, one of the um, prominent issues was that the attrition rate was quite high. Not a lot of people finish anatomical pathology training, and I wanted to find out why, right? And I was warned that that might be a difficult topic, but nonetheless, I persevered. So some of the challenges that I had with that was that when applying for ethics approval, I had a lot of issues with POPI Act. I needed to have a methodology that's not going to infringe on that. And that would mean that I needed to have a way in which I can contact people who have undergone training in anatomical pathology. So yeah, I mean the conversation has to be between you and your supervisors, you and the department, you and ethics, and you and your employer to kind of get to an approach that can work for everyone. For us, we opted to have a questionnaire that would be completely anonymized. We wouldn't know who filled it in or from where. And that research questionnaire could not be sent out directly by me or my supervisors to the participants of my research. So we essentially sent our questionnaire to the NHLS. We sent our questionnaire to the different departments in anatomical pathology. We sent it to the International Association of Pathology. And as a last resort, I also posted my research questionnaire on LinkedIn, for just to help disseminate to those who may have not received it. And I think that helped a lot. Um, yeah, I mean, that was the only issue essentially, because we just kept going back and forth to try and circumvent the issue of POPI Act. And eventually, when they were happy, we got the ethics approval, and yeah, and we got the research. We did the data collection. I've got the data, and now I'm writing it up.
Thank you so much, Dr. Tlali. You touched briefly upon sort of the process that one would go through in developing a research protocol. And part of that is establishing the research objectives. So how important do you think it is to identify and, just clarify what your research objectives are right at the beginning of your project?
Yeah, I mean, it's very important. And it's, oftentimes you find that in your research, you pick up on things that you never thought you'd pick up on. And the temptation is very strong to further elaborate that in your write-up, right? But if your protocol did not allow for those things that you picked up in your research, you're not technically allowed to further expand on them. So one way to kind of work around that is maybe using your literature review, try and predict what you might find in your research. Like just have a section in your protocol where you say, we predict that this might happen, and if you find it, we will further elaborate on it. Or if you don't hypothesize that you might find something like that, and you do end up finding it, you'll just mention in your dissertation and say that unfortunately it's not in the scope of the MMED, but it does leave room for further research going forward, and that might be something you either hand down to a future registrar to the MMED, and you can supervise it, or you can also use it as something, as a stepping stone for your PhD.
Thank you so much. And then just one last question. And you briefly touched upon this when you discussed, what sort of considerations need to be taken when one is choosing a supervisor. But I just wanted to ask, were there any particular resources or support structures that proved to be particularly useful to you when you were beginning your research?
Oh, that's a good question. To be honest, not really. Right. I picked up on one of the consultants who, when we started, they were very well, not necessarily approachable. They were very forthcoming to the new registrars to kind of welcome them and shield them from any negative energy that they might feel at the beginning of the training. Because I mean, yeah, there's a lot of negative energy that can come because a lot of people do resign and people can feel like, oh, you might be starting, but you'll never finish. And from there, I kind of also kind of picked up that he's really into making sure that people stay and follow through their training. And I think because that happened pretty quickly, I didn't need to explore additional resources that can help with either choosing a supervisor or a topic.
Thank you so much, Dr. Tlali. These are definitely insights that are worth considering. So thank you once again for your insightful presentation and this very informative Q&A. Colleagues, this
Thank you so
brings
much.
us to the end of the first webinar in our series. The next webinar is scheduled to take place on the 5th of August and we'll be exploring the different approaches to literature review and methodology, and that will also include appraising articles as part of exploring the different approaches to literature review. Once again, I would like to express my heartfelt gratitude to our speakers this evening for sharing their expertise, their experience, and their insights with us as we all embark upon, this process of completing our MMEDs within the allocated time. Colleagues, thank you so much for joining us this evening, and please be reminded to extend the invitation to other colleagues who have got a keen interest in research but may not be in the REG program as yet, but are exploring various aspects of research or show a keen interest in research in any other way. Thank you for joining us, and I hope that you have found this session to be most useful. Thank you. Bye.